Today we're journeying back in time, not to a world of knights and castles, but to the often terrifying world of medieval medicine. So grab your smelling salts, you might need them, as we uncover medieval medical practices that killed more than they cured. First up, the star of the show, the one, the only, bloodletting. The theory behind it was the concept of the four humors: blood, phlegm, yellow bile, and black bile. If you were sick, it meant these humors were out of balance. The quickest way to restore that balance? Just let some of the excess out. Doctors, and more often, barber surgeons, would use a fleam or a lancet to nick a vein and let the blood flow. Feeling a bit feverish? Let's bleed you. Got a headache? Let's bleed you. Feeling a bit down? You guessed it. Let's bleed you. The problem, of course, is that this often led to weakness, shock, and severe infection from unsterilized tools. Draining a significant amount of blood from an already sick person was a recipe for disaster. Imagine having a simple infection, and the prescribed treatment is to make you weaker and potentially introduce new bacteria directly into your bloodstream. It's a wonder anyone survived. George Washington, centuries later, is a famous example of how deadly this practice could be, even when performed by the best doctors of the time. Next on our list of horrors is trepanation. This is the practice of drilling, cutting, or scraping a hole into the human skull. Why on earth would anyone do this? Well, medieval physicians believed it could cure a whole host of ailments, from severe headaches and seizures to what they considered madness or demonic possession. The idea was to release the evil spirits or built-up pressure that they thought was causing the problem. The procedure itself was unbelievably risky. Without anesthesia, patients had to be held down while a surgeon took a primitive drill or saw to their head. The risk of infection was astronomical, not to mention the high probability of slipping and causing irreparable brain damage. While some skulls found by archaeologists show signs of healing, suggesting some people actually survived the initial procedure, many more surely succumbed to infection, blood loss, or the sheer trauma of it all. It's a gruesome reminder of how desperate people were for any kind of cure. Now, let's talk about some questionable pharmaceuticals. Forget your local pharmacy. The medieval apothecary was a cabinet of curiosities. One popular remedy was theriac, a complex concoction that could contain dozens of ingredients, including things like vipers, flesh, opium, and sometimes less exotic things like cinnamon and honey. While some ingredients might have had minor benefits, the mixture was often a gamble. The quality control was non-existent, and the recipes varied wildly. But theriac was mild compared to some other treatments. Need a cure for a cough? How about a syrup made from snails? Got a wound? Why not apply a poultice of animal dung? Yes, you heard that right. Poultices made from the dung of pigs, goats, or pigeons were thought to have healing properties. While we now know that some types of mold found in dung can have antibiotic properties, like penicillin applying raw feces to an open wound, it was far more likely to cause a raging case of tetanus or gangrene than to cure anything. And let's not forget about the use of heavy metals. Mercury was a go-to treatment for a variety of conditions, most notably syphilis. Patients would be told to rub it on their skin, inject it, or even ingest it. While mercury can kill the bacteria that causes syphilis, it's also incredibly toxic to humans. It causes severe neurological damage, kidney failure, and eventually a slow, painful death. The saying, "one night with Venus, a lifetime with Mercury," summed it up perfectly. You might cure the disease, but the cure would kill you in the end. Arsenic and antimony were other toxic metals, commonly used as medicines, with similarly devastating results. Surgery in the medieval period was less a medical procedure and more a brutal act of butchery. Surgeons were often seen as craftsmen rather than doctors, and for good reason. Without a proper understanding of anatomy or sterile techniques, surgery was a last resort. Amputations were common for injuries or infections that wouldn't heal. A saw, a strong stomach, and a few assistants to hold the screaming patient down were the main tools. Speed was the surgeon's greatest skill, as a quicker amputation meant less time for the patient to suffer and bleed out. But survival of the surgery was only the first battle. The next was cauterization. To stop the bleeding from an amputation, surgeons would apply a red-hot iron poker or boiling oil to the stump. This sealed the wound but also caused immense pain and massive tissue damage, creating a perfect breeding ground for infection. If the initial shock or blood loss didn't kill you, the post-operative infection probably would. So, how did anyone get better? The truth is, many didn't. For common people, healthcare was a mix of folk remedies, prayers, and sheer luck. The human body's ability to heal itself was often the most effective medicine available. These extreme treatments were typically reserved for those who could afford them, which, ironically, may have put the wealthy at a higher risk of dying from their doctor's care than the poor. It's easy for us to look back and laugh or cringe at these practices, but they were born from a genuine desire to heal in an era with limited scientific understanding. These weren't malicious acts. They were the best attempts of people trying to fight disease with the knowledge they had. It highlights just how far we've come and makes you appreciate the sterile, evidence-based medicine we have today. The next time you take a simple aspirin for a headache, spare a thought for your medieval ancestors, who might have been prescribed a drill to the skull for the same complaint. Thank you so much for joining me on this rather grim journey through medical history. If you found this fascinating, don't forget to like, subscribe, and hit that notification bell for more dives into the weird and wonderful parts of our past. See you next time.